Still getting new plugs the day after deep cleaning? It's not pressure, it's process. Today I'll show you advanced blackhead and pimple removal that clears fast, protects your barrier, and keeps pores clean longer. Cleanse, lift, extract, aftercare, recurrence-proof. We'll run each step with timing and technique so you don't overdo it. Warm open, 3 to 5 min. Gentle steam or warm towel on T-zone, jaw, to soften oxidized sebum. Optional bowl boost, green tea or 1-drop tea tree. Dual cleanse, 60-60. Oil cleanse, 60s, on dry skin, nose creases, sides, chin. Emulsify, milky, rinse. Gel, foam cleanse, 60s, with salicylic, BHA, or heartleaf, green tea to sweep inside pores without stripping. If your face feels tight after rinsing, it's too harsh. Tightness, chach, barrier stress. Targeted exfoliation map. Press, don't rub. Blackhead zone, nose, sides, chin. BHA 0.51%, 2 to 4x week PM. Sensitive areas, cheeks, jaw. PHA, LHA, or lactic 1-3x week. Enzyme assist, 1 to 2x week. Mix a pinch of papaya pineapple enzyme powder with cleanser for 45s to digest the dead cell cap. Timed clay magnet, weekly, 8-10 min. Kaolin bentonite plus splash of green tea. Rinse at over 80% dry before cracking to avoid dehydration. Now for the most delicate step, extraction. This should only be attempted when a blemish is truly ready, meaning it has a visible, firm, white or yellow head that is very close to the surface. If the pimple is just a red bump, or the head is deep under the skin, it is not ready. Patience is your most important tool here. Proceeding too early will only cause more inflammation and potential scarring. Before you even think about touching your face, proper preparation is non-negotiable. Thoroughly sanitize your Comedone tool with rubbing alcohol, or if using your fingers, wrap them securely with fresh tissue. This crucial step prevents introducing new bacteria into the open pore, which could lead to infection and a much worse outcome. Position the tool or your fingers at an angle beside the pore, never directly on top, which can bruise the skin. Apply slow, gentle, rocking pressure. Observe the direction of the pore and work with it, not against it, to coax the contents out cleanly. Adhere strictly to the rule of 2s. If the blockage doesn't lift within 2 gentle tries, you must stop. Forcing it will create microtears in the skin and almost certainly lead to post-inflammatory hyperpigmentation, or PIH, that stubborn dark spot that long outlasts the pimple itself. For stubborn whiteheads that aren't clearly surfaced, resist the urge to poke and prod. Instead, apply a hydrocolloid patch overnight. It will gently draw out the fluid without breaking the skin. And let's be perfectly clear, there is absolutely no at-home extraction of deep, painful cysts or nodules. These have no visible head and are rooted deep in the dermis. Attempting to pop them is a guarantee of scarring. Treat and protect them only. Immediately after a successful extraction, your aftercare is critical. A quick, localized dab with a salicylic acid solution helps to clear out the pore, followed by an ice roller for 30 to 45 seconds to calm inflammation and reduce redness. First, soothe the area. Immediately after extraction, your skin needs calming hydration. Use a gentle, alcohol-free toner or essence featuring ingredients like Centella asiatica, heartleaf, or panthenol. These are known for their powerful anti-inflammatory and skin-repairing properties. Pat it in gently. Don't rub. This step reduces immediate redness and prepares your skin for targeted treatments. Next, treat smart. This is not the time to layer multiple aggressive actives. Instead, choose just one targeted treatment that directly addresses your primary concern for that area. If you're dealing with oily, congested skin and large pores, a niacinamide serum at a 4 to 5% concentration is ideal. It works by regulating sebum production to balance oiliness, and has the added benefit of visibly refining pore appearance over time. For any lingering red or inflamed marks left behind by previous breakouts, apply a thin layer of azelaic acid. This gentle acid is brilliant for calming residual inflammation and brightening the post-inflammatory erythema, or PIE, that can persist after a spot has healed. For any active inflamed whiteheads you didn't extract, use benzoyl peroxide at 2.5% as a targeted spot treatment. Its antibacterial action directly fights acne-causing bacteria. If your skin is sensitive to BP, a sulfur-based spot treatment is an effective alternative. Finally, seal everything in. A compromised skin barrier can lead to more irritation and oil. Use a lightweight gel moisturizer containing humectants like hyaluronic acid and barrier-supporting ceramides. Proper hydration is key, as it prevents your skin from overcompensating with rebound oil production. And if it's daytime, this last step is non-negotiable. Shield your healing skin by applying an SPF 30+ non-comedogenic sunscreen. UV radiation not only slows down the healing process, but also significantly deepens the pigmentation of dark marks, making them harder to fade later on. Now, let's build a recurrence-proof routine. This is your long-term strategy to maintain clear skin and prevent future breakouts. The key is consistency, not aggression. We'll use a simple night rotation schedule, often called skin cycling. This involves rotating your active ingredients. Stacking multiple strong actives in one night can overwhelm your skin, leading to a compromised moisture barrier, redness, and even more breakouts. By giving your skin dedicated nights for exfoliation, treatment, and recovery, you get all the benefits without the backlash. On night A, we exfoliate. After cleansing, apply a BHA like salicylic acid to your mapped T-zones to dissolve sebum deep in the pores. Follow with a soothing serum and a lightweight gel moisturizer to avoid congestion. Night B is for cell turnover. Use a pea-sized amount of a retinoid, like adapalene, to regulate skin cell shedding and prevent clogs. Apply it to dry skin, then follow with your soothing serum and moisturizer. This sandwich technique helps buffer potential irritation. Night C is your essential recovery night. Use no strong actives. The focus is on replenishing your skin's barrier with hydrating serums, rich in ingredients like ceramides or hyaluronic acid. Finish with your gel moisturizer to seal in hydration. This night is non-negotiable. It's what makes the active nights effective. And a critical rule: never stack retinoids, strong acids, and benzoyl peroxide in a single night. Combining them is a fast track to irritation and a damaged barrier. Once a week, perform a reset. Gently steam your face for a few minutes. Use an enzyme-assisted cleanser for a mild exfoliation boost. Then apply a clay mask. Rinse when it's about 80% dry to draw out impurities without stripping your skin. Finally, simple hygiene makes a huge difference. Wash your pillowcases twice weekly, wipe your phone screen daily, and always cleanse your face within 10 to 15 minutes after a workout to wash away sweat before it settles in. Deflate. Wrapped ice 60-90s for pain, swelling. Area treat. Thin, azelaic, salicylic veil over the zone, not just the dot. Spot. BP 2.5% or sulfur rice grain amount. Protect. Hydrocolloid overnight. If bumps are mostly cystic, nodular, or scarring, book a derm, RX retinoids, procedures. 48 HERS. Calmer redness, flatter whiteheads. 7 to 10 days, smoother nose, chin, fewer new plugs. 4 weeks, visibly reduced breakout cycle with CLEAR, plus night rotation. Drop A if you're running the CLEAR code tonight. Comment your skin type plus toughest zone, nose, chin, jaw, and I'll pin a tailored mini-map. Like, share, and subscribe for barrier-safe routines that actually work.